All right. A 14-year-old belongs to a gang that bullies and bunches other teens, engages in sexually promiscuous behavior, attends school infrequently, and argues with her parents, claiming they are just old-fashioned and don't understand her. What does the assessment data support about the patient? A, that she's exhibiting problems related to conduct and behavior. B, that she cannot accurately appraise reality. C, that she's seriously and persistently mentally ill. Or D, that she should be considered for group home placement. All right, so the answer here is A, that she's exhibiting problems related to conduct and behavior. This patient is demonstrating disturbed conduct and behavior. This patient demonstrates under-socialized aggressive behavior, such as repetitive and persistent pattern of aggressive conduct in which the basic rights of others are violated. All right, next question. The nurse planning care for a mentally ill patient bases interventions for recovery on which of the following concepts? A, that the patient has areas of strength on which to build. B, that the patient has rights that must be respected. C, that the patient comes with experiences that contribute to his or her problem. D, that the patient shares fears that are similar to those of all mentally healthy individuals. The answer here is A, that the patient has areas of strength on which to rebuild. Nurses support recovery by evaluating patients with mental health issues for their strength and their areas of high functioning. It's important to build on and encourage the strength and many attributes of mental health in patients with mental health issues. Next question. An individual is found to constantly wear only a bathrobe and neglect the cleanliness of his apartment. When neighbors ask him to stop his frequent outbursts of abrasive areas, he acts outraged and tells them he must sing daily and will not promise to be quieter. What does his behavior support about him? A, that he is demonstrating symptoms of bipolar disorder. B, that he is socially deviant. C, that he's egocentric. D, that he is not demonstrating any definitive signs of mental illness. The answer here is D, that he is not demonstrating any definitive signs of mental illness. One myth about mental illness is that to be mentally ill is to be different and odd. Another misconception is that to be healthy, a person must be logical and irrational. Everyone dreams irrational dreams at night, and irrational emotions are universal human experiences and are essential to a fulfilling life. Some people who show extreme abnormal behavior and are characterized as mentally ill are far more like the rest of us than different from us. No obvious and consistent line between